Assalamu alaikum wa rahmatullahi wa barakatuhu. You're watching Sisters Corner on Iqra TV, and I have a lovely guest, Jasmin Malek, today. And as we were discussing before break, a lot of different issues about sisters who are watching us now, and they are with us, and a lot of information we are sharing for you. And Dr. Jasmin is telling us different things in detail, which is really, really important for you. So if you just joined us, please keep staying with us, because you can know a lot about women's health. And I would like to go again to Dr. Jasmin. As we were discussing before the break, obviously we have discussed different conditions where we cannot, like period pain and kind of like different things. I would like to go take the topic further to menopause, you know, which is really, really important for the ladies to know and people around you. Obviously, you go again, a lot of hormonal changes in your body, in your health, and then how does it affect? I would like to discuss with Dr. Jasmin and what it is actually. So yes. Head to you.
Absolutely. So what is the menopause?
Yeah.
Do we know? I don't think a lot of women know what menopause is in the South Asian community. So essentially it's when your periods stop. Mm-hmm. Menopause typically starts around the age of about 50. Mm-hmm. Okay. Yeah. But the symptoms, you might get symptoms for about 10 years before. So from 40 to 50, you might be in something called the perimenopause, which is where your body is slowly changing and your hormone levels are going down and down and down and down.
Wow.
Women might see that their periods become quite irregular, longer gap between your periods. Yeah. And also a lot of women in this time feel very unwell. They say they have joint aches and pains, their whole body hurts. Wow. You know, they have anxiety. Sometimes women have anxiety driving and they never used to. Yeah. Sometimes they have sleeping problems. Sometimes they have itchy skin. Oh, wow. You know, sometimes they will see that, you know, their ears are itchy, you know. Yeah,
hair fall,
you know, weight gain as well.
Oh, wow.
They can feel quite hot and sweaty. And they can also sometimes feel something called brain fog, where you just can't think clearly. You can't find that word. You know, you're talking and you can't think of the right word, for example, or you're at work and you can't think properly. So these things are all part of the perimenopause. Yeah. I think in the Asian community, we don't talk about the perimenopause or the menopause enough. Yeah. And a lot
this is why you are here today, so we can discuss it actually and share the information with our community.
Absolutely. So I really want to raise awareness, educate, you know, people like my mum, my aunties, my cousins, you know, and all the viewers watching, because we don't really know enough about it. And it's a major life transition. It's a real changing point from being, you know, a woman that's, you know, at the height of her, you know, health, and actually there is a slow decline in health, and people don't know why they don't feel well. Why do I feel tired? Why does my body ache? Why can't I think straight? Why do I feel anxious? Why can't I sleep? And people start thinking about all these things. They go to their GP quite often, have blood tests, everything's normal. You know? And then they think, what's wrong with me? Am I going mad? And I've seen this, you know, with aunties in my community. They all, when they get together, my joints hurt, you know, I can't sleep. But actually, this is the menopause. And is there solution for it? Is there treatment?
Dr. Jasmin is sharing very, very good information. But I can see actually around me, like people complaining about all these things. That's why I was like kind of laughing at as well, because I didn't know about the conditions you are discussing. And this could be the cause, actually, main reason behind.
Yeah, absolutely. So, I mean, I wouldn't call the perimenopause or the menopause a condition. It's not, but it's a normal part of a woman's life, you know, that she will go through. Yeah. And with it comes changes, you know, like we have changes at puberty when you go from a child to a woman. Yeah. It's like another change in your life. And actually, it's something we need to speak about more openly in our communities, our husbands, our partners, our sons, they need to know what's going on with us to explain some of the changes. So a lot of women in the perimenopause or menopause say that they get very angry, they have rage.
Changing in the mood.
Yes, they get very angry, they might have arguments with their husband, and their children might, there might be arguments at home, and some people don't know why, because an hour later, they might think, why did I get so angry?
Yeah.
It's unlike me.
So if you're argumentative kind of, you're having that kind of a behavior, so it means it could be the cause if you're in that age. Yeah.
Yes, absolutely. So, so essentially that's what menopause is. It can be, I mean, it can really affect people's lives quite significantly. Some women say they have to quit working. Some women have marital problems and they end up separating or divorced, having arguments with their children, for example, or relatives, and it can really impact them. And also when women are not sleeping, it can affect their mental health and physical health. They feel tired. And the good news is there are treatments available. There are things where we can give women their hormones back.
This is really good. We want to know that, actually. This is why Dr. Jasmin is here. So we have the reason, we have the illness, we have the disease, whatever issues we are going through. But this is not the end of the life. We have, on the other side, good light. Yeah,
absolutely.
We have to, So we have to be positive. There are treatments available, and we are going to share like some of them with you today.
So, is there help? Yes, 100% there's help. So, one way of helping is HRT, hormone replacement therapy. Now, not all women are suitable for hormone replacement therapy, so a doctor needs to ask you lots of questions and see, are you safe to have this? And then there are other things that we can do. So changes to our lifestyle, for example, the clothes we wear, the food we eat, having a fan on at night, having a window open.
How we can change the clothes we wear?
So we can wear things that make you feel less sweaty, for example. So rather than
loose, maybe,
loose cotton, you know, maybe choose non-synthetic.
Very informative, actually.
For example, because certain clothes might make you feel really hot, sweaty and clammy.
Yeah.
And certain clothes might make you feel a little bit more like you can breathe. Also, workplaces are recognizing that menopause needs to be something that we are talking about and that women are supported in. So if you think you are going through the menopause or menopausal symptoms and it's affecting your work, bring it, you can, well, we should technically be able to bring it up with our line manager or HR to make them aware that actually I had to leave that meeting earlier because I was having a hot flush and I had to leave, you know, for example. So they should be more aware of it and more supportive of you.
And that's your right, obviously, if you're working at any place and you're not feeling well, going through any condition. You should be discussing it with your employer, and you have right to take off or, you know, coming early, or for any reason you're not feeling well, you're not feeling fit. It's always better to discuss, better to disclose, you know, and then you can get the right help at the right time.
Yeah, I mean, will every employer understand and be sympathetic? I don't know, but if you feel like your supervisor is going to listen to you, or they're a woman, or you know, they're a man that understands because they're you know, it's worth talking about. So gauge it and see, is it going to be appropriate, and will people listen to me? But 100% organizations should be supporting their women.
Dr. Jasmin, another question, most important questions in our Asian community, I can see is about family planning, you know, and different contraception, you know, methods. And obviously a lot of ladies are having one after other, and then like 3, 4, like under age of 5, you know, and their health condition is getting so worse, you know. And every, you know, kind of each year, they're very young and they are struggling, you know. Even though, obviously, we should be having children, but sometimes it is difficult from different perspectives as well. And I would like to discuss with you, especially health-wise.
Absolutely.
So what do you think? What would you suggest? How important is it, or where we are?
I think so. No, great question. I think a woman needs to be in her best health to carry a baby. So, for example, before considering having a baby, you know, is the mother healthy? Is she anemic? Does she have any thyroid problems? Worth getting a blood test to just check everything. Is she eating the right foods? Is she having her vitamins, you know, her vitamin D and folic acid, you know, and just making sure that mother is in optimal health. So if you do go ahead, that pregnancy is a good, successful pregnancy.
Exactly.
Now, in terms of the gap between your babies, I mean, it's people's choice. However, what I would always say is make sure that that mother is back to good health before considering another baby. Just recently in clinic, I saw a mother who was really anemic after her first baby, and the couple wanted a second. And actually, my advice was, and I can only give advice.
Exactly, obviously.
My advice was, well, why don't we treat the anemia first? Make sure she's not feeling so exhausted and tired, because actually a baby will take more of the iron from her and make her more anemic. And you know, we don't want women to suffer. There's nothing noble about suffering and you know, giving yourself.
Exactly. This is what we are actually trying to discuss is sometimes we are not recovered from first baby, and then we have the other one, and then the women's are going through a kind of very bad health situations where they cannot look after themselves, and then on top two babies. So if you want to have obviously want to try for another one, please, as Dr. Jasmin has mentioned, we have to be healthy enough to carry another one.
Absolutely. I think that's the sensible way. Definitely.
So which is very, very important. What would you like to discuss about, like obviously after having a baby? We have discussed postnatal depression after as well, and then we have discussed during the pregnancy. But after the baby, obviously, it's a huge responsibility, especially for the women who are having first baby and did not have experience, and they are finding it really difficult. So what sort of things are important for them to look after for themselves and the baby?
Is this after?
After the pregnancy.
So I would say sleep is so important. So obviously babies cry, they wake up, they need nappy changes, they need feeding. But if there is any support available, or somebody can on occasion, you know, like you take it in shifts with your partner or a relative, you know, can you look after the baby for, you know, between the time of 1 and 4, for example, that I can get, you know, 3 or 4 hours sleep. I think sleep, sharing the night shift, it's not just the woman's job to look after the baby all night. If you can and your husband is supportive, then, you know, share the responsibility of those night feeds. So take the help, take the support. And then after having a baby, it's really important to eat well, especially if you're breastfeeding, you know, make sure you're getting enough nutrition, you know, you're having your vitamins, etc. And I think also exercise, getting out of the house. So sometimes women are just like, I'm tired, I haven't slept, I'm just going to stay inside. And actually what happens is it can snowball into postnatal depression, where you're not getting out, the air is not hitting your face, you're not seeing the sunlight, and you feel stuck, you feel trapped, and you feel depressed. So I would say, without fail, every day you must, even if you don't feel like it, get yourself and that baby out in a pushchair and go for a 20-30 minute walk.
You know, Dr. Jasmin, one thing came in my head. In our community, it happens actually. A lot of ladies, sisters, they follow obviously traditional ways, but they do not take bath like 40 days after having the baby. So is it healthy or
Definitely not. Please have a bath.
Very good.
Please have a bath. I don't think anywhere in our religion does it say don't have a bath.
For 40 days,
It's a cultural thing that I think was created by our forefathers or foremothers. But it's not good for you. So please have a shower as soon as you've had your baby. Have a bath.
The first thing after having the baby, obviously you should be taking a bath.
Take a bath.
And it's very relaxing as well.
A bath is relaxing when you have that cool, you know, that lovely warm water. Also, if you've got stitches down below, sometimes you do need to sit in a bath, you know, to
it helps to heal.
Absolutely. So 100% take a bath. I would say have a shower every day if you can, because it's a nice way of starting the day.
And it's good for the baby as well, you know.
Some people say, how do I have a bath? I've got a baby. So I would say keep the door, if you can, keep the door open. Keep the baby in, you know, the baby carrier just at the front of the door so that you can still see them and they can see you if you can. But 100% I would say have a shower every day. It will make you feel
and sometimes obviously how about I would like to say breastfeeding moms. This is another topic as well. because some ladies, they do not prefer to breastfeed their children because they feel like they're going to lose a figure, or maybe it's not. Obviously, this is everyone's choice. We are not going on that, but we are just going to talk about the healthy side of it, like how it's important and why we should be. So please, how would you relate this to?
Yeah, good question. Again, really good question. So I think sometimes there's a lot of pressure on women to breastfeed.
Yeah.
And as much as I agree and I say that breastfeeding is really great, if you're struggling, if you're finding it...
That's very important to know.
If you're finding it really hard, or your supply's not coming and you can't, what I would say is don't beat yourself up about it, because...
If you can.
A fed baby is a happy baby. So feed your baby with breast milk or formula, it's fine. If you can breastfeed and you want to breastfeed, excellent, go for it. And if you can't, don't feel disappointed in yourself that why couldn't I do this when every other woman can do it. And it's natural and it's meant to be easy. Why am I finding it so difficult? Because it can be difficult for some women.
That's true.
So please don't beat yourself up about it, is what I would say. Try. So what are the benefits of breastfeeding? So it's what nature intended, and it's perfectly formulated. It gives that baby everything it really needs. It gives them also immunity, gives them your defense cells, like your antibodies. So it makes them less prone to illness. Also, for the woman, it uses up calories, actually. So women actually tend to lose weight when they breastfeed because your body's busy making milk, using up energy, and women actually get their figure back quite a lot quicker. I've seen. And
tucking your tummy in as well, it should help. If you breastfeed, that helps a lot, actually.
Yeah, it absolutely helps. So I think definitely the benefits are to the baby and the mother. But what I would say, and I think I was like this after I had my first son, I beat myself up about it, mentally thinking, why can't I do this? It's so hard.
Exactly.
So that's not healthy either.
Because you try to give, obviously, best healthy lifestyle for your child. And if you feel like this is best, and you would like to do it. But if you can't do it, obviously we can't force ourselves.
Absolutely.
Everything is not in our hands.
So exactly. I have 2 children. I have 2 lovely boys. I breastfed one and I didn't breastfeed the other because I couldn't. So, and they're both healthy. They're both well.
Alhamdulillah.
They're both happy.
Alhamdulillah,
so it doesn't actually matter. Do what is easiest for you that will make sure that you're happy. And if you're happy, baby will be happy.
Yeah, that's really good. That's really important. And do not forget to take bath regularly, even if you're breastfeeding, which is, even if you're in 40 days, that's really, really important. Actually, we have to come out of some cultural kind of set rules where we feel like they are okay and we shouldn't be, because obviously cleaning is our half iman as well, and there is nothing like written in any book like where you not have to take bath for 40 days, which is completely wrong. Dr. Jasmin is not only dealing with that kind of medical things, but she is having patients about like if you want to increase your beauty, kind of, I would say, cosmetic kind of things, like if some women, they are having kind of mental issues of it, they think like sometimes they are having not good nose, I would say, or somewhere like,
Yeah, so basically I do injectable treatment.
Yeah.
So that's aesthetics, effectively. So that's things like Botox and dermal filler treatments, as well as skin treatments.
Yeah.
So there's a lot of women that can have sometimes insecurities about certain things, like, for example, a hooked nose. It may really affect them, and they don't really want surgery, but they would like something to help. So this is, for example, one of the reasons someone might come to me, because I might be able to help improve the look of their nose. Or, for example, some women are really insecure about their lips.
Yeah.
And actually a simple procedure can help that. And I've had clients who start crying because they say this is my biggest insecurity and thank you for helping me. And the other reason I've started doing this is because I love art. I'm actually a very creative person.
Oh, I have to discuss. Oh my, we do not have enough time, and I really want to discuss about your art club as well.
So I think, aesthetics for me gives me something where I can combine medicine and safety with a very creative, artistic sort of flair, I think. Another sort of category of women that I see quite a lot is the aging woman. So, in their late 40s, for example, that is starting to see signs of aging, like wrinkles or loss of volume in the cheeks or lines appearing or jowling here. And that can make women feel really have low self-esteem.
Insecure kind of like.
It can it can really reduce their confidence.
And also causing depression as well.
It can. Absolutely. So I would like to be able to help these women feel better, look better, and also do it in a safe way where it's a doctor doing it, because there's lots of non-medical practitioners doing aesthetics unsafely. My results are always natural. I don't want anyone to even know that you've had any treatment. Usually my clients, they say that they just say, people comment about how well they look. They keep saying, you look really well. And that's really my goal. Nothing, fake like you see on TV. With
natural,
natural. And I think that's healthy, to look naturally well. And if a little bit of treatment can help you look and feel better.
Dr. Jasmin, I think if I have 24 hours show, and I would continue with you talking, and because a lot of information and kind of very inspiring personality I have in my program today. And very shortly, I would like to say that Dr. Jasmin is running Children Art Club as well. So just very shortly, if you can tell us, and then I'm going to finish the show.
So this is actually a community interest project that I've started, because I think we really need to start ensuring we're providing things for our children that can get them away from their devices. Art is great because it allows them to focus their mind on a little project for an hour and a half. And it's quite creative, and they feel quite accomplished when they've created something very nice.
That's very true.
And also what I do in my art club is I combine it with breath work and breathing techniques to make them feel relaxed. And also it teaches them for their life that when they do feel stressed or anxious, they can come back to these breathing techniques that I teach them just to calm them down and make them feel okay again.
Very good. Thank you so much, Dr. Jasmin. Actually, I feel like I have a lot in my head today after discussing all these issues with Dr. Jasmin, because I didn't know a lot about it as well. And I hope all the sisters watching Iqra TV, they have enjoyed the show and got a lot of things in their heads as well. I would like to say a huge thank you for coming in my program, and it was a pleasure having you, and I hope to have you again, please. So thank you. Thank you very much. Now I would like to say thank you to all the sisters watching our program, Sisters Corner. And Assalamu Alaikum. See you next week with another show with another guest. Allah Hafiz.